Good morning, everyone. Today, uh, I will be discussing about autonomic nervous system. And in the autonomic nervous system, I am starting with the adrenergic nervous system and in the adrenergic drugs. So these are the competencies what I will cover today. And here the pH is the pharmacology. So according to latest curriculum, we have to learn about the competencies, and the pH is the pharmacology. In the pharmacology competency 1.13.5, this competencies clarifies about the adrenergic drugs, and this we will see the today we will see these competencies 1.13.5 to 1.13.8. Coming to the nervous system, we can divide the nervous system into two, central and the peripheral nervous system. And in the central nervous system, we all know the brain and the spinal cord comprises of the central nervous system. And in the peripheral nervous system, we have one is the somatic nervous system and one is the autonomic nervous system. So we will dealing here with the autonomic nervous system. As the name suggests, it does not require any control, it is autonomic. And in the autonomic, we again have the two division, one is the parasympathetic and one is the sympathetic. The parasympathetic is also known as cholinergic because the neurotransmitter here is the acetylcholine, and the sympathetic is also known as adrenergic because the neurotransmitter here is the adrenaline, noradrenaline or dopamine, as we will see later on. The autonomic nervous system basically divided into sympathetic and parasympathetic. You have to remember the origin of sympathetic. The origin of sympathetic is thoracolumbar, thoracic and the lumbar vertebra. It covers the sympathetic nervous system, T1 to L2 or L3. A parasympathetic, as the name is suggesting, beyond sympathetic, so it will cover the upper and the lower part. Upper and the lower part is the cranial and the sacral. You know about the vertebra. It's the cervical, thoracic, cranial, lumbar, sacral. So parasympathetic is the cranial and sacral division, and the cranial nerve, it includes the 3, 7, 9 and 10. How we will remember the cranial nerve? When you combine the 3 and the 7 part, 3 and 7 is equal to 10. 7 plus 3 is equal to 10, and in the center and in the middle one we have the 9. So 3, 7, 9 and 10 is the cranial nerve, because it is most very commonly asked which cranial nerves are the parasympathetic cranial nerve. So 3, 7, 9 and 10 and S2 to S4. So this is the parasympathetic craniosacral division. So clear? So we have the sympathetic and the parasympathetic division. So you can divide the ANS into two parts. One is the sympathetic and one is the parasympathetic. Why sympathetic is necessary for our day-to-day life? Sympathetic is necessary during the extreme of situation. जब आपको डर लगेगा, जब तो sympathetic system activate होता है. तो mobilizes the body during extreme situation. और parasympathetic resting state पे parasympathetic activate रहता है. मतलब maintenance activities parasympathetic की रहती है. तो ये sympathetic and parasympathetic, these counterbalance each other. That means if there is an increase in sympathetic, there will be decrease in parasympathetic. If there is an increase in parasympathetic, there will be increase in sympathetic activity. So this is how the body regulate the activities. One more system is there, that is known as the enteric nervous system. It is entirely different from the parasympathetic and the sympathetic nervous system, and it is in the intestine part and controls the digestive function. So neurotransmitter, I have told about the neurotransmitter, the cholinergic nerve, the neurotransmitter is acetylcholine. In the adrenergic nerve, the neurotransmitter is adrenaline, noradrenaline, dopamine. Why I am writing only 3? There are because these are the endogenous catecholamines that we will see later on. Endogenous and exogenous catecholamines. Now you can see by the diagram why I told you about 3, 7, 9 and 10 cranial nerve. So this is the parasympathetic. I told you para means beyond. So upper and the lower extremities we will cover the parasympathetic craniosacral. So the nerve originates from the cranial and then it goes to the effector organ. So parasympathetic, cardiac, smooth muscle, glands and nerve terminal, and This is the sympathetic. This is again the sympathetic. In the middle part, you will find the sympathetic system. This is again the sympathetic system, and this is the sacral part. This will be parasympathetic. Okay, very good. This will be parasympathetic again. So sacral, cranial and sacral will be the parasympathetic, and this is the skeletal muscle, somatic and the skeletal muscle supply. Okay, so you can see something this is the you can say this nerve is very much this nerve is quite bigger than this nerve. Okay, prejunctional nerve. This is the prejunctional nerve. This is the junction. This is the prejunction. This is the postjunction. The prejunctional nerve is much bigger than the prejunctional nerve of the sympathetic. So the one difference is you will notice here that sympathetic nerve, the prejunctional nerve is smaller than the parasympathetic prejunctional nerve. This you can, and alternatively, and you can comment about the postjunctional nerve also. Postjunctional nerve is much bigger in sympathetic, and say in parasympathetic, postjunctional nerve is smaller than the sympathetic. So this is the thoracolumbar outflow. I have told you about thoracolumbar outflow. Again, the diagram illustrating the nerve, the prejunctional, postjunctional nerve, sympathetic, parasympathetic. This will be the sympathetic part. This will be the sympathetic part, and this will be the parasympathetic part. Okay. One more thing you can see from here, that here in the parasympathetic, I have told you about the neurotransmitter will be the acetylcholine. So in the junctional part, always the neurotransmitter will be the acetylcholine. But if the nerve is parasympathetic nerve, in the post-junctional part, it will be a parasympathetic. It will be acetylcholine. In the sympathetic nerve, it will be the noradrenaline, always noradrenaline, adrenaline, or dopamine. Adrenergic nerve transmitter will be there. But here is an exception. It is the sympathetic gland. Sweat gland is a sympathetic gland, and it should contain the post-junctional noradrenaline or adrenaline or dopamine, but it is having the acetylcholine because its function is to increase the secretion. And when you face any problem, when you see the lion, then always your sympathetic activity will get increased. I told you about in the emergency situation, sympathetic activity will get increased, and that is the reason. And the if there is a acetylcholine present, then only there can be the secretion, like sweating. Sweating is seen with the nerve is sympathetic, but the neurotransmitter is acetylcholine. So this is the important part. Now, this I told you, sympathetic ganglia lie just outside the vertebral column in the paravertebral chains. Parasympathetic ganglia occurs much closer to the target tissue. Parasympathetic ganglia. This is the parasympathetic ganglia. This is the sympathetic ganglia, and this is the parasympathetic ganglia. So, acetylcholine, neurotransmitter is acetylcholine. And if there is a so here what will it be? Acetylcholine. In the junction part, there will be acetylcholine, and here acetylcholine muscarinic. And when you see this one, here the neurotransmitter will be the acetylcholine again, and then again here the neurotransmitter will be the, it's an exception. So don't say it's a sympathetic, but an exception. Again it will be acetylcholine. Here the neurotransmitter is acetylcholine, and here the neurotransmitter noradrenaline. Acetylcholine, here the neurotransmitter dopamine. Dopamine mainly present in the vasculature. We will see that also. Here the neurotransmitter is acetylcholine, and here will be the neurotransmitter acetylcholine again. Okay, acetylcholine neurotransmitter NM or NN, the nicotinic and muscarinic receptors are present. That's why it's written N and M. Okay. Coming to the next slide. Just remember one thing. Sympathy is related to the heart, and if the sympathy is related to the heart, always the sympathetic system will lead to the increase in the heart rate. All other activities will be decreased by the sympathetic system, and this is ulta with the parasympathetic system. Parasympathetic system heart rate ko kam karega, and other activities will be increased by the parasympathetic system. So you can see sympathetic system increasing the heart rate, plus is there, decreasing other places it is decreasing. So in the bronchus, bronchoconstriction will be seen with the parasympathetic system. Sympathetic system will dilate the bronchus. Dilate the bronchus. In GIT movement will be increased by the parasympathetic, so it will cause diarrhea. In sympathetic, the movement will be decreased. I told you decreased. That will lead to the constipation. In the bladder, movement is increasing. Urinary outflow will increase. In decreased urinary outflow with the sympathetic system. In the gland, secretion, I told you, secretion is increased with the parasympathetic. In the sympathetic, decreased secretion is there. People, one more important point you have to remember about C for cholinergic, C for constriction. C for cholinergic and C for constriction. So C for cholinergic and C for constriction. So there will be the constriction of the pupil with the parasympathetic, and there will be the dilatation of the pupil with the sympathetic. Okay. So these are the various catecholamine. These are the various adrenergic drugs which are synthesized, and how they are synthesized. First, the tyrosine. First there is a tyrosine. Tyrosine get metabolized to dopa with the help of enzyme tyrosine hydroxylase. With dopa decarboxylase, then it forms the dopamine, and then dopamine beta hydroxylase, then it forms the noradrenaline, and this noradrenaline will convert into the adrenaline. So these are the endogenous catecholamine. So what about the exogenous catecholamine? Exogenous catecholamines are the dobutamine, isoprenaline, phenaldopam, and dopexamine. So endogenous and exogenous catecholamine. This I have shown alpha methyl p tyrosine is inhibiting this decarboxylase activity, tyrosine hydroxylase activity. So that's why endogenous and exogenous catecholamine are the two catecholamines. Why catecholamine? Because it's having the catechol ring and the amine group. That's why the catecholamine. One more thing is there. We can classify the adrenergic system into direct, indirect, and mixed action. Why direct action? Direct action means it stimulates the receptor, alpha and beta receptor. When directly it stimulates alpha and beta receptor, then it is the direct action. And when when they are increasing the activity of adrenaline or adrenaline either by inhibiting its metabolism, then it is an indirect action. So direct action, indirect action, and mixed action. When both the actions are there, then it is a mixed action. So here we can classify the adrenergic agonist into direct, indirect, and mixed action. This I have taken from the Goodman-Gilman 13th edition. This chart is there in the book also. So classify the direct acting into selective and non-selective, because this is very important. Alpha 1 agonist, name of the alpha 1 agonist. Alpha receptors are alpha 1, alpha 2, and beta receptors are beta 1, beta 2, beta 3. If the drug is stimulating selectively any receptor, then it is a selective. Alpha 1 it is stimulating, then alpha 1 is phenylephrine. Alpha 2 stimulating agent is the clonidine, and beta 1 dobutamine, beta 2 terbutaline. Non-selective, when it is stimulating one or two or three receptors, and non-selective, like alpha 1 and alpha 2 is stimulating oxymetazoline, beta 1, beta 2 isoproterenol, isoprenaline is also there, which beta 1, beta 2, beta 3, alpha 1, alpha 2, beta 1, beta 2, epinephrine also known as adrenaline, and alpha 1, alpha 2, beta 1 only, then it is norepinephrine. Remember the differences between the noradrenaline and adrenaline, because it is very important in the with the receptor point of view. Noradrenaline, it is not all, it only stimulates alpha 1, alpha 2, beta 1, not the beta 2. So not all. Adrenaline will stimulate all, alpha 1, alpha 2, beta 1, and beta 2 receptor. Mixed action is the ephedrine having the both the directly acting or indirect activity, alpha 1, alpha 2, beta 1, beta 2, and indirect acting. We can promote the release. We can promote the release of these adrenergic agonists, amphetamine, tyramine. We can inhibit the uptake with the help of cocaine. You can inhibit the metabolism also. MAO inhibitors and COMT inhibitors, selagirin, and MAO inhibitors, selagirin, and COMT inhibitors, and capon, taucapon. So this is the classification of adrenergic agonist. So how we can classify the adrenergic receptors? Receptors we can classify into two types, alpha and the beta receptors. Alpha, we have the alpha 1, alpha 2, and beta, we have the beta 1, beta 2, beta 3 mainly. And alpha 1 we can again classify into alpha 1a, 1b, 1d, and alpha 2, alpha 2a, 2b, 2c. This is the action of alpha 1. Alpha 1 receptor present in the blood vessel, and when it is stimulated, it will cause vasoconstriction. Alpha 1a receptor is present in the eye, and when it is stimulated, it causes mydriasis. I told you the adrenergic, cholinergic, C for cholinergic, C for constriction. तो एड्रेनर्जिक उसका उल्टा करेगा, मिड्रियासिस करेगा. प्रोस्टेटिक यूरेथ्रा में अल्फा 1a है तो डिक्रीज द आउटफ्लो कम कर देगा उसका, स्टिमुलेट करोगे तो. और अल्फा 2 रिसेप्टर्स प्रेजेंट इन द प्री सिनेप्टिक और पोस्ट सिनेप्टिक. प्री सिनेप्टिक it acts like a brake, and when you stimulate the presynaptic receptor, it will decrease the activity. That's why it acts as a brake to sympathetic system. And postsynaptic is the same from as like alpha 1. Beta 1 are basically present in the heart and the juxtaglomerular cells of the kidney, JG cells of the kidney. The heart will increase the heart rate. I told you only the adrenergic will increase sympathy is related to the heart. So it will increase the heart and the BP, and the JG cell renin secretion will increase. Rest everywhere is the beta 2, like in the lungs it will cause the bronchodilation. GIT it will cause constipation. Bladder decrease the outflow. Glands it will decrease. All with it will be decreased. Uterus, tocolytics, it will decrease the movement of the uterus. Blood vessels, vasodilatation, and skeletal muscle tremors. These are the classification of adrenergic receptors, alpha and beta receptors. Again, you can classify the adrenergic drugs according to its therapeutic use. According to its therapeutic use, it can also be classified, because adrenergic drugs can be used in multiple situations when you want pressure response to increase the blood pressure. When you want to increase the blood pressure, then you can use the adrenergic drug like noradrenaline, ephedrine, dopamine, phenylephrine, methoxamine, phentermine. You should know about the receptors also. When you want to stimulate the heart, like in heart failure condition, adrenaline, isoprenaline, dobutamine. When you want the bronchodilation in asthma, so as a bronchodilators, beta 2 receptors are present in the bronchus. The beta 2 agonist should be there. Isoprenaline, salbutamol, terpentine, salmeterol, formoterol, bambiterol. When you want nasal decongestant to relieve the nasal vasospasm, so xylometazoline, oxymetazoline, nefazoline, phenylephrine, pseudoephedrine. When you want to stimulate the CNS, the drug which I use is amphetamine, dexamphetamine, methylphenidate. And when you want to decrease the weight, then also amphetamine, fenfluramine, sibutramine. And when the uterine relaxant relax the uterus in premature labor, then the drugs are ridodrine, isoxapine, salbutamol, terbutaline. One more endogenous catecholamine is the dopamine. It has some important property because it acts on all the three receptors: D1 receptor, beta 1 receptor, alpha 1 receptor, according to the dose. When the dose is less than 2 to 5 microgram per kg per minute, that means it will act on the renal blood vessel, causing the vasodilatation of that. When it 5 to 10 microgram per kg per minute पे देंगे, so it will increase the myocardial contractility by acting on alpha 1 receptor, beta 1 receptor, and alpha 1 receptor to cause vasoconstriction when the dose और बढ़ा देंगे तो. So at this dose, all the three actions will be seen. So basically, this is indicated when the patient having shock with oliguria, because it will increasing the renal blood flow also. So it's much it can be given in the renal failure patient also, as compared to noradrenaline or adrenaline. So finally, coming to the various uses of adrenergic drug, as you have seen, that it can be used in the heart block, because adrenaline, dobutamine, isoprenaline, adrenaline acting on all the receptor, dobutamine acting on beta 1, beta 2, and beta 3. No, dobutamine only beta 1, and isoprenaline all the receptor, beta 1, beta 2, and beta 3 receptors. Stimulating the SA node, alpha and beta agonism, and increase the force of contraction. The positive chronotropic, inotropic, and dromotropic effect is seen with this. Now, hypotension and shock. If you have the orthostatic hypotension is there, then ephedrine and midodrine, and because it constricts the blood vessel, and in case of hypovolemic shock, dopamine. And dopamine basically it is preferred. I told you about the cardiogenic shock because it increases the renal and the mesenteric blood flow. And there is a renal failure also, then dopamine is very much helpful. Anaphylactic shock, adrenaline is the drug of choice for anaphylactic shock. Intravenous route is the drug route. And for IM also given. During local anesthesia also adrenaline is given because it will constrict the blood vessel and it will increase the duration of action. For addition with the lignocaine, it will increase the duration of action of the lignocaine. So adrenaline is combined with the lignocaine. This also question come in your universities. Another use is the bronchial asthma. Bronchial asthma, by targeting the beta 2 receptors, we can dilate the bronchus. Non-selective agonists are the adrenaline, isoprenaline, and selective, if you are talking about, then beta 2. Beta 2 is selective, salmeterol, terbutaline, salmeterol, formoterol, or cipraleine. Another is diarrhea in diabetic. In diabetes patient, there is diarrhea seen with the diabetes patient because of the neuropathy component. So in that, the clonidine can be given. Other uses of clonidine is also very important, like in hypertension, clonidine is a alpha 2 agonist. In hypertension, opioid and other narcotic drug withdrawal syndrome, migraine prophylaxis, drug of choice for migraine prophylaxis is salmeterol, beta 2 agonist. Glaucoma, apraclonidine and brimonidine. The clonidine congener is apraclonidine and brimonidine. Postmenopausal vasomotor symptom, some painful condition, pain aesthetic medication to potentiate anesthetics. Another adrenergic drug use is the CNS stimulant. We can stimulate the CNS, amphetamine, dexamphetamine, methamphetamine with the adrenergic drug. So it's used in the narcolepsy. So excessive daytime sleepiness is there in narcolepsy. So we can treat this condition by CNS stimulant drugs like amphetamine, dexamphetamine, methamphetamine. ADHD patient seen commonly in the children. So in that also the CNS stimulant drugs are used. In the obesity, for the obesity also, we can use the adrenergic drug and act as an appetite suppressant, amphetamine, fenfluramine, dexfluramine, sibutramine. When there is a hypoglycemia, if you give insulin, there is a risk of hypoglycemia. So if there is hypoglycemia, then also adrenergic drug can be used because it reverses the hypoglycemia. The hypoglycemia can be reversed by the glucose or the adrenaline. How it is do so? It stimulates the alpha 2 adrenaline act on all the receptor. By alpha 2 stimulation, reduce the release of insulin from beta cell. By beta 2 stimulation, causes glycogenolysis and gluconeogenesis. By beta 3 stimulation, causes breakdown of triglyceride to fatty acid. As Midriatic, we can use the adrenergic drug, and the drug which used is the phenylephrine. Phenylephrine, sympathomimetic drug, is used as a Midriatic. Alpha 1. Phenylephrine act on alpha 1. Alpha 1 stimulation on dilator pupillary muscle causes the mydriasis. Glaucoma, adrenaline and adrenaline congener है dipivefrin, apraclonidine, brimonidine. These are the drugs used in glaucoma. How they act on glaucoma? Alpha stimulation decreases the aqueous humor secretion. It stimulates the alpha receptor and which decreases the aqueous humor secretion. Urinary incontinence, if there, as I have told you, the adrenergic drug will decrease the urine outflow. Decrease the urine incontinence can be used. Ephedrine and pseudoephedrine. Urinary retention occurs due to relaxation of retrocell by beta 2. Beta 2 stimulation will cause relaxation of retrocell and contraction of trigone by alpha 1 action. As uterine relaxant also, adrenergic drug can be used. Tocolytics, we say the tocolytics when there is a premature contraction. Isoxaprine, ritodrine, salbutamol, terbutaline. Isoxaprine is very commonly used as a uterine relaxant. Beta 2 stimulation, because beta 2 stimulation relaxes the pregnant uterus. Nasal decongestants, very commonly used by the ENTs, and the nasal decongestant are the phenylephrine, oxymetazoline, xylometazoline, nefazoline, ephedrine, pseudoephedrine, phenylpropanamine, to reduce the nasal obstruction. So finally, the adverse effects and contraindication. The adverse effect is seen because of the drugs acting on the receptor. If excess drug will act, then tachycardia, palpitation. It will act on the heart, tachycardia and palpitation, arrhythmias, and can lead to the hypertension also. Restlessness, Excess stimulation of the CNS will cause restlessness, insomnia, anxiety, tremor. That is contraindicated in angina because it will aggravate the angina part as it is causing the vasoconstriction, acute MI, cardiac asthma, hypertension, hyperthyroidism. With halothane, it will increase the risk of arrhythmias. So don't give the adrenergic drug with the halothane and don't give adrenergic drug with the beta blockers also. Okay. So this is the my YouTube channel. You can see the other videos also by subscribing the YouTube channel. Thank you.